Selma Jones, and she has a story of a breast cancer survivor. So we can start with you. I guess we have a little bit of time. So let's go ahead.
Thank you. And if someone's looking for their keys, they're up here. There's
Yeah,
yours.
they're mine up there.
Okay. Well, thank you so much for the opportunity to share my story. My story to me is just as important to learning what happened when my diagnosis occurred and the life that I led since then. So in September of 2006, I was enjoying part of my retirement, which included going to Costa Rica to study Spanish. It was a couple of weeks before I left that I noticed a lump beneath my arm. And of course, out of the excitement of going to Costa Rica, that certainly did not stop me. I just thought, okay, I'll deal with this later. And this is important because education and awareness about a disease is so important. And of all the years that I had read about cancer, and this is in 2007, I had never read that a lump underneath your arm could be a sign of cancer. So this is my story as a result of that. I spent more than 3 weeks, about a month actually, in Costa Rica studying Spanish, and would feel that lump and would say to myself, oh, when you get back to Washington, you should take care of that. And I would feel that lump periodically. I returned, and 2 weeks later, we were in Guyana, South America to celebrate my son's 25th birthday, to visit his paternal side of the family. I would feel the lump periodically and say, when you return, you should take care of this. I subsequently did 3 trips. And remember, we're talking from September 2006 when I first noticed it. And it was when I was at a speaking engagement at a family reunion conference. I'm showering and I'm feeling the lump had not only gotten harder, but it appeared to be larger. And I had a talk with myself. Delma, you need to slow down and get this checked out. And I went to the doctor upon a few days after I returned. And what transpired has changed the trajectory of my life. I was told that I have a rare and aggressive form of breast cancer. When I asked why was it considered rare, my oncologist said that in the United States, when doctors diagnose breast cancer, they almost always know the origin of it. In your case, you're one of the 5% that we cannot determine the origin of it. But we must have surgery right away. And I questioned, but if you don't know the origin, then how will you know when and where to start cutting or to stop cutting? But it was his assurance that he knew what he was doing. And at that point, some fear and trepidation started, and I asked, could I get a second opinion? That's important because many people in this country, when they're diagnosed with breast cancer, particularly African Americans, or we're diagnosed with a disease in general, we do not seek second opinions. Whatever the doctor tells us, that's what we do. Some of us are even conditioned and socialized that way. But in my mind, I questioned that decision to have surgery right away. I sought a second opinion with someone that he referred me to. I even questioned that person because I thought, who is she? Is this someone he's had a relationship with in the past? Is this the best friend of his daughter from college? Is his next door neighbor? Not, is she competent, crossed my mind. It was the relationship. And I went to this doctor, and her treatment regimen was completely different than my first oncologist. He wanted to have surgery right away. I was advised that I had a number of large tumors that were matted together and that surgery was not the best option, but instead shrinking them with chemotherapy so that we could see the lay of the land and then surgery. Well, I have two opinions at this point and I'm frightened. I don't know who is correct. So I sought a third opinion, which is really, really rare. And if we don't have insurances that allow us to do this, this is not something that everyone can do. The third opinion then was the same as the second, two women. And I went with the second woman because the third one was in Baltimore, and it posed a challenge for me in terms of, will my family, friends come to see me when I'm hospitalized? I underwent chemotherapy or neoadjuvant treatment from July, the day after the 4th of July, until the end of October, middle of November. And then I had 7 weeks of radiation every day. And it was during radiation that I saw a flyer and I went to Baltimore to become trained as a certified breast health awareness speaker with the American Cancer Society, trained under the tutelage of the renowned Lily Shockney. And every 2 years since 2008, I've gone back to be recertified, and Lily Shockney has trained me in all except one. But even before then, when I was undergoing chemotherapy, my doctor asked me if I could talk to 2 of his patients. And I wanted to know, why did he feel I could share anything with his patients that he couldn't as a doctor? And he assured me that I could. So there we were in a room, my oncologist, well and highly trained, an oncology nurse, and 2 women who were as scared to go through what was ahead of them as any way you could possibly imagine. And I asked the doctor prior to their coming in, what do I say to them? Should I be honest? Should I glaze over it? Should I just touch the iceberg? And he said, Thelma, be honest. Tell them what you're going through, because they have refused to accept treatment and their cancer is fairly serious. One was concerned about losing her beautiful hair. I started talking to these 2 women, and then I noticed my doctor abruptly left out, and it caused my confidence to drop because I thought, okay, I've said something wrong. But then I thought, you know, he didn't train me to do this. This is not my job. So I'm doing the best I can, and I just continued to keep talking. And as a result, those women went through chemotherapy treatment. I understand that my time is up. That was a quick 8 minutes. Okay. So, sorry that I really didn't get to share.
Thank you, Ms. Jones. We appreciate you sharing firsthand with your experiences. Next, we'll our next speaker is Reverend Dr. Adrian Gaikama. Please come up, and he will be
Thank
talking
you very
about
much. Thank you.
coping with cancer, brother to brother, dealing with prostate cancer.
Thank you very much, Sister Thelma, for your testimony. I have known Sister Thelma for many, many years as I work with the American Cancer Society. She's very, very involved in cancer prevention. She's an educator. And just we thank God for you, my sister. Also, so happy to see that my good friend, the Reverend, Kennedy's there, and the wonderful work that he does. So grateful. And my sister there, who once has worked with us, the American Cancer Society. We did many programs together, and I thank God, we're going to see you again. And thank you for being such an inspiration. I want to speak as really a public health practitioner, but also as a pastor, And I think that my narratives are just my experience, my practice as a pastor, and again my practice as a public health scholar just are interrelated, because what I'm about to share here derives really from my experience in what I do. For about 7 years with the American Cancer Society, my work was to engage faith-based communities in cancer prevention, but not only to engage them in cancer prevention programs, but also to promote mechanisms by which they cope with cancer. And I work with many different groups that the American Cancer Society called the cancer support groups. And many of those groups were in churches. And the work I did as the faith-based project manager just made me to work not only in this Washington metropolitan area, but also to travel from town to town to places like Atlanta. And also, my experience as a pastor gave me that opportunity to meet people who are suffering from cancer. But not only people who are suffering from cancer, but also the families who are engaging them in the process or in the therapeutic process. What do I learn? What do I see? Different challenges. We know the first one is physical, that people who are unable to do what they used to do. And that's a big challenge when sometimes when people do not even recognize themselves anymore. That is really this me or somebody else. Why? Because of the effects of treatment. And times and again, I would go to those cancer support groups and just in tears because of stories and testimonies I hear. That the people just coping, just with treatment, and again, the effects that the treatments are having on them. Not only are the challenges are physical, but they are also emotional, really. Emotional. As we know that that relationship between physicality and emotional or psychological is huge. When I remember seeing people or seeing somebody in my office who came to see me with his wife and speaking the extent to which the sexuality was a big problem. Why? Because the brother has been going through treatment, and the treatment had an impact upon just the sexual life. That was a very serious one. Not only that, I had to listen to him as, or to them as a help commander, but again as a pastor. At times and again, Sister Thelma, just you are there, you don't say anything. All you do is only to listen. That's one of the things that I learned as a pastor. Just the work that I do, that rather than speaking when somebody comes to see you, all you do is only to listen. Just the emotional or psychological just effects of cancer are so huge. And also one can talk about social consequences or effects. You know, sometimes when somebody goes through that experience of cancer, coping cancer, one just becomes a subject of talks. Many the milieu where I come from, there are issues of stigma, which is a big issue, and just the concept or the term cancer, just in my milieu, is a taboo, and just it is really a death sentence to some extent when people just talk about cancer. But what you and I know really, that any cancer, when it is detected earlier, it is preventable. That's why just we focus a lot on prevention. Social effects, consequences are so huge. I have seen just divorces, I have seen separations, and just why? Because one has gone through that experience of just cancer. Finally, I have seen also spiritually how cancer has just such impact. Some people just the experience of cancer has led them to be closer to God. I'm talking as a pastor. But to others, just it is really the issue of questioning God. Where are you? Why me? Why me? Why me? Why me? But to finish, what I can say, that one of the things that helps people to cope with cancer is what anthropologists call the therapeutic management group. By therapeutic management group, we mean that group which is made up of medical doctors, friends, relatives who care. And that's very, very important. And I think just when one goes through that experience, what one is expected from just other people is that care, that sympathy, that love. And I think that's all that I had to share. May God bless you. Thank you very much.
Thank you, Reverend, for sharing. Next, we have Reverend Kennedy Kwazi Osafi. And he will be talking about also, I think he has a special topic, right? I think your topic changed a little bit, right?
Yes.
Okay.
Thank you. Yeah, I'm to dwell on how immigrants, especially undocumented immigrants, are challenged when the issue of cancer comes up. Working with the immigrant community, my organization focuses on working with immigrants in the county. And our attention is mostly on the undocumented. And even looking at the documented immigrants, they have problems because this is a country where you cannot just come documented and then you get access to everything. So I may say they face the same problem, how to access services, how to cope with the culture, how to get a lot of things, their children, if they come with children, how to get their children settled and get back to school. These are some of the major things that immigrants, all immigrants across the board, face. But when we come to the undocumented, you could see the difference. First of all, they have nothing, no documentation. So it's difficult for them to go out even to seek for services. It is difficult for them to take care of their health because of being afraid to be apprehended and deported. So when there was an incident whereby one of our community members was diagnosed with cancer, she couldn't tell anybody, being afraid. So she wanted to keep it. But luckily enough, one of the children came up to me and told me, this is what has happened to my mom, but we don't know what to do. She has no insurance, no document. Thanks to Montgomery County that they have services for undocumented. So this woman was taken to the mobile clinic. Even to go on her own, she couldn't. So I have to take her there to introduce her. She was taken care of, and she started to get treatment. But the problem was, as someone said earlier, the stigma of some of these diseases or sicknesses is there. So emotionally, this woman was going through a lot of stress. I'm going to die, because that's the concept. When you have cancer, you are going to die. And the family was always not ready, afraid she's going to die. So what do? We have to bring the family together for counseling, to get someone from the health department to come and talk to them, to see that so long as your mom is getting treatment, she will survive. And to be honest with you, the woman left here, go back home. Before she left 2 years ago, the cancer was gone. Because it was the beginning. See, so she's now home, we communicate every day. But one thing we have now is the immigrants population, which form the bulk of the African community, especially in our area. How do we reach out to them? Because a lot of them have a lot of problems, health problems, not only cancer. But if you are not able to see a doctor, how can you be diagnosed with other sicknesses? So this is something that we have to look at. As a religious side, what we have to do is, I think the health institutions should try to involve the religious organizations so long as the churches have become the sanctuary, as they term them, for undocumented immigrants, so that services could be brought, screening could be brought to the churches, whereby these undocumented immigrants are secure to come out to go through screening, rather than telling undocumented immigrants, especially at this time, you know, the air going around, to come to a government facility for screening or for service. So I think this is something we have to work to, because a lot of our non-documented immigrants have a lot of health issues. We don't know them, they don't know it, until they get access to what? Service and screening. Thank you.
Thank you, Reverend Quasi, and just want to just add a little bit to that. I do agree with you, because I have a family member that experienced that, as far as they got diagnosed with cancer, and there's the fear. He was undocumented. It was a family member that was dating a man that never got his papers here for years, and the fear that they have of seeking medical
Sure.
attention. So that's definitely real. Even a lot of immigrant people in the immigrant community, they don't want to go. They don't get
Right.
checkups on those things. So we do need more of that. Even the churches are a very good place to spread this and educate our community on these types of issues and this proper health care. So thank you so much. Okay, next I would like to bring up Reverend Renee Woodward Few, and she'll be talking about health and spirituality, helping young adults and families with anger and guilt of life-threatening health diagnosis.
Good afternoon, everyone. I come with a compassionate heart, of course, because there are so many challenges that we in the health field have to deal with, and so many times persons have taken improper approaches when it comes to trying to correlate spirituality and health, and you run into all kind of different, challenges. In beginning the company Few Ministries, my goal was to really reach out to communities and help educate them on means of correlating spirituality with their health concerns. Because sometimes when you just deal with the health matter, it can, create a paranoia in persons, and a lot of times they shun away from even facing the challenge at all. Some other persons in faith-based groups and things like that, sometimes they are so busy focusing primarily on prayer and other strategies which they correlate with healing, that they don't get the medical attention that they need. So, I've learned by being in the field that being able to pull the two together can really have a profound effect. And I say that because I'm a witness. I was not diagnosed with cancer, but a senior in college, I suddenly began to have seizures and had no idea where that came from. And lo and behold, I was a senior in college about to get my degree and zoom on into public education and teach everybody I could, anything I could. And lo and behold, I was slowed down because I was continually having frequent seizures. And what happened was that I would persevere. I couldn't quite understand. I had some sad days, but I did not believe that was going to be my lifestyle. I believe I had been educated and planned to go better the lives of people by way of education. So I believed that I was going to get better. 7 long years, I was challenged by epilepsy. Finally underwent major brain surgery. They removed parts of my brain where the activity was taking place. After that, I had to go through years of therapy because, after surgery, what is that crunchy stuff you put in drinks to make it cold? What is that crunchy stuff? Does anybody know what that is? Ice. I couldn't even spell ice. Had my degree and was ready to go out and teach, but I couldn't even spell ice. So I had to go through, therapy to get back into a state where my brain was functioning what society might call normal. But believe it or not, when the brain changes, other parts of the brain get stimulated, so you end up using part of the brain that you might not have been using well before. So it's a good thing to be motivated to put the spirituality and the healing together. And the spiritual aspect of that was that each weekend, I was going to University of Maryland College Park, each weekend I would go to my home church, and my pastor had this passion of anointing people's head with oil. Isn't that something? So that increased my faith. My faith allowed me to persevere and keep believing that I was going to get better. So doing that, I was diligent. I got healed from epilepsy, and my faith grew stronger. Went back and was able to go back to teaching again and all of that. So it's the belief system has a profound impact on how health impacts your body. When it comes to cancer, if persons are diagnosed with cancer and they end up shunning away from it and don't want to deal with it and just pray, they can run into some serious challenges because again, you have to be able to learn how to put the two together to make to have the benefit that it needs as far as the prayer and the healing. But just remembering, scripture, talks about if you have the faith the size of a mustard seed, even just a little bit of faith can have profound effect, what you believe, on your healing process. So again, what is it that you're choosing to believe? Do you believe that you're at the end of your rope? You're going to behave as if you're at the end of the rope. Do you believe that there are higher or greater things in store for you? You'll act accordingly. You'll persevere and go toward those higher things. So it's a matter of recognizing that your mindset, is going to impact how the cancer affects you, the hope that you have, the spirituality that you have, all of that has strong correlation on the physical health. So what is it that you're going to implement or individuals need to implement to make sure that when they get a diagnosis, they don't automatically, I call it go down and reach rock bottom. Anytime that, we come together and you try to learn different ways of weighing the spirituality and the health, any and everybody has to decide what's most important to you. Sometimes we get a doctor's diagnosis, we don't like it, we have to get another opinion, right? That's not a sin to get another opinion. Sometimes you learn all that you can in the medical arena, and then you can determine, where you need to go in that area, and at the same time continue to pray diligently and keep your faith strong with that. When we're dealing with young adults and things like that that's out here challenged by different health situations, we can teach them the spiritual aspect too. My thing is just being able to speak their language, have real dialogue with them. Don't slap them with the these and thous, because that can make them shun away. But again, speak to them in their language where that can have a profound spiritual impact, and it can really make a difference in their lives. So, I'm just hoping and praying that we can do more of the correlation between faith and healing, because, again, everybody, as much as we pray and all, everybody is not healed physically, right? Everybody's not healed physically, but you can get a spiritual healing where you can transition, you can, die and transition peacefully, because you know that your spiritual provider is on your side, The spiritual provider has a better place for you. Your spiritual provider has greater things in store than you encountered on this earth. So again, it's being able to put those together, and even working with young adults and, people in school. I'm a good storyteller. I tend to, try to get the kids and the teens right there, to deal with the major issue of today and see how the health and ministry spirituality is correlated with that. So, my prayer is that we can come together, partnership much better, and try to put the two together to bring peace to many families. I'm not going to act like everybody gets healed, from cancer. Everybody doesn't, but they can be at peace knowing that they can face the challenge and be able to get through it. And they're not alone in the process.
Thank you, Reverend Few. We definitely need to involve the church in these issues, because this is a psychological and mental issue. It takes an impact on the family, on the person. So I do agree to pastors being involved. Very important. Next, we have Dr. Philip Lucas, and he'll be talking about LGBT communities, family relationships, and the impact of illness. And we have a little bit of time. They're calling us back, I guess, to wrap up. So just maybe a few questions, and then we can wrap up. Thank you.
Okay, and I'll try to scoot things right along. Good afternoon, everybody.
Good afternoon.
It's good to see you all. I guess, so some of my information is a little different, because as our wonderful moderator says here, I'm talking about LGBT communities, but even with that, those alphabets, things that sometimes we're not even real clear about. I have an outside voice, so I don't need to use a microphone. So LGBT, what is that? What does the acronym stand for? Can somebody tell me?
Lesbian, gay, bisexual, and transgender.
Okay, lesbian, gay, bisexual, transgender, right, LGBT. The reason I was asked to talk about this, well, first of all, I'm a university professor, I'm a psychotherapist also. I teach at Howard University in School of Social Work. I teach at GW, George Washington University School of Public Health. And I'm in the Graduate School of Counseling at Trinity University, but also do therapy and consulting. And we actually work with churches through the Wentz Center for Loss and Healing. So I do a lot of work around grief and bereavement. I work with homicide victims and also with churches. So we're going to churches and talk to them about grief and loss and bereavement, in addition to my therapy work. But I teach a graduate course in sexuality. So I was asked to come based upon my work around sexuality. So LGBT, we say what they are, kind of rattle these things off. Sometimes people get them all mixed up. People say, why do we have to have all these alphabets? And when we look at gay, lesbian, bisexual persons and illness, cancer, and families, that is why, what I was actually asked to address. There's a lot of different thoughts and beliefs, though, also just about somebody being gay or lesbian or bisexual. I didn't say transgender because transgender really doesn't belong in the alphabets. So gay, lesbian, bisexual is a sexual orientation, meaning who I am attracted to. who someone is attracted to. So lesbian attracted may be attracted to another woman, gay actually is a man attracted to another man, and bisexual is somebody who might be attracted to both, either concurrently at the same time or sequentially, this year and next year. But transgender is actually an identity. So we really should not be including LGB and the T, because T is who I identify as, who I am, not who I'm attracted to, as in lesbian, gay, bisexual. So I had to get that out kind of first. And I know we're going to have questions and comments in a minute, but has anybody got any question about that or don't understand?
How does the community feel about that when they hear you say it? Because
the community accepts that, because even when you look at gay lesbian persons, the transgender community, their struggle is very different than the gay lesbian community. And transgender persons are still struggling in a whole different way for acceptance, recognition, inclusion that gay lesbian people have started to kind of bridge the gap. And I know we got some ministers here from different places, so I'm very interested also in people's feelings about this gender identity and sexuality. Because I can stand up here and talk to them blue in the face and give you good information about how families receive persons who might have cancer, who may be gay, lesbian in their homes. But I know that just in my classes, sometimes people are not necessarily accepting. So again, when we think about the faith communities, that becomes a real challenge. So I end up looking at ministers, and they look at all the ways they get on their phones, they do all sorts of other things. When I start talking about gay lesbian folks,
to me about
because they well, you're not the only person, but I'm just saying, look, I just keep it real. So okay. But we want to, make sure that, again, we recognize the fact that with these families, when someone identifies and is open about their sexual orientation or their attractions to others, but we do have some families that are very supportive of those persons. And then we have families who are not supportive of their loved ones. When that person then is identified as having cancer and may need the additional support of the family members, sometimes that's when the rubber really hits the road. The families perhaps have been maybe accepting of that person, and that person is accepting of the family too, because people are just who they are. But when it comes to making critical decisions, and someone has a partner or a life partner or is married to someone of the same sex or same gender, that sometimes becomes a problem for the family in terms of who decides, who can visit. That person, they may be in a programming facility where there's some gatekeeper. It becomes an issue in terms of finances, sharing, wealth and any kind of property. For some people, that's really when we see some real challenges with family members. And that's kind of also the premise of talking about this, because we really want to encourage people to accept each of us, each person for who they are, and our sexuality. And so I'm really glad that you mentioned sexuality, as you talked about prostate cancer and how it impacts people. Because I said, I teach sexuality, I don't just teach about gay, lesbian people. We teach about everything, about relationships, how you communicate with each other, how you date somebody. So from that perspective, we're all just human beings, but sometimes when cancer or a terminal illness comes into the life of a family, we know that it disrupts that homeostasis, the balance in that family. And when that happens and the person identifies as gay, lesbian, bisexual, or transgender, then sometimes it becomes a problem for the family. So I have people, I just did an assessment with a 20-year-old Reverend View, who is a transgender woman, and her family is having a hard time kind of accepting it. They will accept her as a gay boy, but not as a woman, as a transgender woman. But in addition to that, a family member died of cancer, actually, a nephew of hers. And going to the funeral, other places, they want her to dress in male clothing. So then we talk about persons, and so this also happens with people in the hospital. It happens, fortunately, for persons when if they succumb to death for whatever reason, family members take over. And that person, unfortunately, then is at the will or disposal of that family, and they may decide, you were born with a penis, so then we're going to address you and address you as a male, when that person for their entire life has known that they were a woman. They just happen to be born with a penis. and they identified and dressed and lived in as that person. It's certainly more complex than 8 minutes, but at least wanted to scratch the surface. Because this is, and I commend the team who invited me here, because I think it's very forward thinking that at least the dialogue is open. Because until we have these dialogues and accept each other, that the blood flows through each of our veins the same, that we breathe the same air, we drink the same water, and many instances we do pray or honor and worship the same higher power. And it's from that place that, again, we need to kind of make sure we're working with a person. So that's it. You had a question or comment?
I said this is wonderful.
Thank you, Dr. Lucas. Definitely that topic, I know many people feel uncomfortable about it, especially when you're talking about, like you said, faith-based and, you know, there's different issues. But, you know, these are topics, these are issues, it's real. And it's definitely difficult for the people that has to live that life and not really being accepted. They feel closed in, and even let's say they're dying, coping with cancer, many issues, and definitely we need to talk about it more.
Yeah, and if I just would also want to talk about people being in the closet too, because there are a lot of people who are gay, lesbian, or bisexual, even transgender, who their families would not accept them, so they live their entire life with that. And if somebody's got cancer, having certain kind of secrets and holding on to things like that can fester, and that actually contributes to their demise or the illness that they might have, holding some of those kinds of things in. But you know, so.
Okay, yeah, definitely. It's an interesting topic. You know, I wish we could discuss more. But we do have to wrap up. I think we're going to start the afternoon session. Quickly, anyone have any questions for our panelists? Okay.
Not so much a question, but I certainly would like to invite Dr. Lucas to speak at the Thelma D. Jones Breast Cancer Fund support group. I think this is a very important topic. All that he said I experienced with a very close family member where we did not accept him. And he became a transgender. He developed cancer. And I think that really made matters worse. Some of his family accepted him and some didn't. And then he transitions, and we learned that this is a person who is well known internationally for his work and advocacy on HIV, transgender, and the rights of and sex trafficking. And it took his death for us to know that we were against his lifestyle, and he was out making a difference in the world.
I'm sorry, Thelma, can I ask you, was the person born with a penis or vagina?
A penis.
Okay, so then we addressed her, but it's her. She identifies as a woman?
Yes.
Okay, so then we refer to her as her now, right?
Well,
Is
that was the thing. He gave us permission. He made it very clear because I had to speak at his funeral. And when they said, you must refer to him as a her, and we made it very clear. We may flip-flop from her to his, but he made it very clear to us that we knew him as Butch and as a man, and that we shouldn't give up that.
Wonderful.
So he allowed his family
Yeah,
members
He allowed
exactly.
to
Yeah.
maintain that.
Wonderful, beautiful.
Was he addressed as a male or female?
As a female.
Okay.
Yes.
Nice.
And they accepted when I slipped up a couple of times. They called him.
Very nice.
Okay.
I'd be happy to join you.
Okay.
Yeah.
Thank you.
My name is Arlen Roberts. I have a question for, I think,
Philip
Dr.
Lucas.
When you mentioned the issues in which family members may face if a person happens to have differences in agreement with their sexual orientation, how can you really convince the audience to understand that in dealing with anyone's finances or anything else, you have the same argument for heterosexual?
Yes, ma'am.
That you have
You sure do.
So I think I'm trying to always grasp the fact that what is the difference, and how do you get people to understand that your finances and whatever your wealth you've maintained, whether you be hetero or anything else, you still gonna have the battles and the fight among your family members.
Excellent.
So the only difference is one's sexual orientation.
Yep.
How you handle and resolve those issues should be the same as if he was a heterosexual.
I agree with you 100%.
And I think that's
Right.
part of the issue that people face. We always think there's something so different about how you handle it. I don't care if I'm married to my girlfriend.
Right.
My finances, how I have it set up, should be honored.
Right, exactly. Right. I did a similar session at an estate planning. I went to a church and they were talking about estate planning, and so they asked me to come and speak about LGBT persons. And you're right. We would hope that anyone who is dealing with the relationship and a family steps in, that you're going to have the same issues. However, what we do know though is that if that person has already been having some challenges with their family, specifically related to sexual orientation, and being married to the same sex, and sometimes now we recognize same-sex marriages and some of the legal kind of supports that people have, but still those are those challenges that families have. And you're right, we do have them in straight couples as well. But I think the reason people ask me to come and talk about it is because by someone being gay or lesbian, sometimes the family is not necessarily accepting of that person anyway. The same as they might not be accepted of a woman who, any number of reasons, the man she chose, or, they had a baby early or something. But this does become kind of a societal kind of anomaly, something different that, again, still has to be talked about. And then certainly as we invite in transgender, this discussion of trans persons, that becomes a whole nother issue because we can't get our heads around how somebody can say that they are, a woman, but they were born with the penis. And so I do reference penis and vagina and not man or woman because that's how people, identify. Yeah, but you make an excellent point.
Thank you. So we're gonna wrap up. Are we done, or we have a little bit of time, or? Okay, any more questions? Maybe one more question? Okay.
Well, mine is just one of the comment. Thank you for everybody and Ms. Velma for sharing your story. My background is in medicine and OB/GYN and gynecology. I think one of the things we need to do for our community is to encourage how to seek or where to seek information.
Yes.
I think that's one of our challenges. Years ago, things were difficult. You have to go to the library to get things. Nowadays, that doesn't happen. You can sit down in your house on your phone and get information. And there are information on government sites that are reliable. I believe in today's age, anyone who is going to see a physician or any medical practitioner for that matter, educate yourself, not because you want to go and argue with them, but go in with some knowledge where you can ask questions and say, well, I read this, can you educate me on this? And it's very interesting to hear that you had to see 3 people to make a decision. One of the challenges that I see, obviously I wasn't born here, but I've had privilege of living in different parts of the world. The health system in the United States is very complex.
It is.
Very, very complex.
And it's money
I've
driven.
had colleagues who, unfortunately, when they get ill, some cancer, some cancer, that's when they realize and say, it's so complex. I said, well, because you're working, you didn't realize how complex it is. So when decisions are made, for example, you see an oncologist refer you to a person, you go there, they are not talking. In some places, like in the UK, for example, that practice, sometimes you have these combined clinics. So 2-3 people are there, and they are talking to you, so you can ask questions. Then they go back and say, okay, oncologist is there, radiologist is there, surgeon is there, and say, okay, fine. How do we go about this? And so they are all talking with one voice. But when you have different opinions, I say, okay, what does the patient do? I mean, you said this, you said that, so where do I start from?
And you're already confused and
Right.
scared.
So we need to learn to empower ourselves. I think that's one of the challenges that even though there's information out there, we are not empowering ourselves. And like the man of God said, there has to be a lot of focus on prevention, especially for the immigrant community or undocumented, because that's probably the only option they have. Because now you don't have health insurance. I did public health too. So in Baltimore, I had some experiences that some of the people there shared, that people who don't have insurance, when they are diagnosed with cancer or any medical development, now they've got to look for a physician who will be willing to do it. So this person has to go back and forth for whatever length of time until they find somebody. Now remember, for a lot of these people, they are not wealthy. So if you come 5 or 6 times and say, oh, we are still looking for it, forget it. They stop coming. And then we say we catch them at late stage. Well, the reason why we're getting them late is because we frustrated them at the front.
Right.
Yes.
Right.
They're frustrated. So we have to learn how to educate ourselves so that we become empowered as we go in and know where to seek information. I think that's one of the challenges that we as a Black community have, seeking information and knowing what to do where.
And then if I could just say why I created the Thelma D. Jones Breast Cancer Fund, because I saw myself as an educated person. And I felt that if I were fearful, if I were confused and didn't understand what that person was saying, what in God's name was happening to the people in Southwest DC where I live, where it's the have and the have not, where the largest concentration of public housing exists in Southwest. And I thought, if I'm not understanding it, then Thelma, this is your calling. So when I went into that surgery, my prayer was to the Almighty, if you take me through this, I promise you I will dedicate my life to helping others. And every day I wake up, I'm proud to say that I've lived that promise that I've made to the Almighty.
Well, just to add something, that is, I think one thing I observe about with the Black community, we don't like to share information. A Black person, let me put it, will come here, get something, if it's not useful to him or her, that's it. Whereas when you look at other ethnic groups, especially the Latino community, they share information. So when they get something, you see that all of them would like to come and find out what is there. But one thing I observe among the African community, especially, we reserve information to ourselves.
How many times did I invite you to my church and you came?
I came and you didn't let me in. So this is something I want, because you give the information to them, even in the church, they will leave the flyer there and go home.
Yeah, but I think it's historical. Whenever the Black person is here, Africa, wherever they are, it's a historical issue of trust.
Trust. The Tuskegee.
And until we overcome that,
Yeah.
you know.
And I think
And
just
the Tuskegee Institute
Yeah, so
study
it's a trust issue. And until that is overcome, it's difficult. I agree with you.
one of the things I said earlier, just this morning, is we as faith-based community leaders have to understand the power that we have. Just at my church, when I tell my people we have to do this, guess what? They listen to me. And I'm so sad to see. In fact, your husband came to my church. Daniel Koroma is your husband?
I know you're talking, that's not my husband.
Ah, no, that's your husband. You told me that.
It was her husband.
I'm gonna get up now.
Thank you.
Yeah, see, that's, you see, there we go. Yeah,
Thank you.
there
Let
you
me
go.
say this. I think just there is that urgency for us as faith-based community leaders, many African American community, to start talking seriously. Because just people are dying like flies. And just we know that many of those diseases are preventable if we can educate our people. How many church health ministry just we have in African American churches? We have those churches that are mushrooming. We've got to do something. That just I think we can do that.
Thank you, thank you. Any more last words? Some of my speakers want to say?
Yes, on the first bit, I want to challenge him again. That some of us, the pastors, we misguide our congregation members.
Not me, you.
No, because instead of telling the person, hey, look, medicine is not an holy thing, some pastors insist on spirituality alone so that people will not go to the clinic even when they should go, because the pastors are there asking them to
Right.
fast asking them to pray.
I think
Right.
we
This
must
is
develop what we
something
call
that some
holistic approach, holistic personal
Right.
approach.
that's
what
the
we
challenge
need.
to
A lot of the
ask the
pastors
pastor.
personal
don't
approach.
understand the correlation.
And
That's the
that's
problem. They
what we need to
understand how
talk.
they
So
go
we
together.
need education.
You know,
We need to
either
talk.
one or
We need
the
to
other.
talk.
And I'm actually a mental health professional, so the other issue is that people don't seek mental health treatment because of how it becomes so taboo. You got to have a mental, it stigmatizes. And really, again, our physical health is totally tied to our emotional health.
Very much so.
So people need to feel they can feel comfortable, even in some of our churches, to have maybe even a practitioner there. So now we do some things even at churches where you got a mental health professional that's available to support the faith community, or come in and do workshops. Like I do workshops at different churches on depression, on mental illness, on men and depression, to help us really understand the impact of how that affects your physical health. But again, some pastors are coming along, but we still have some people, take it to the Lord in prayer, and then unfortunately that person sees them at the graveyard.
I mean,
Very good.
even though
Thank
the
you.
faith person, I know you do want to go to your pastor and pastors pray for us.
Yes,
and leave to
right.
God and basically have God will resolve all your problems.
Yeah.
But definitely I do. I'm also, MPH, so
Uh-huh.
I do believe in educating.
Yeah,
our community.
wonderful.
I
Yeah.
wish
Very good.
We do need to work together.
Sure. Great. Yeah. Thank you.
Thank you.